So, oral health is the mirror to the general health. Do you know why I said oral health is the mirror to the general health? Oral cavities serve as the mirror to your body by reflecting some certain signs and symptoms of diseases that affecting the general health. My dear brothers and sisters, so many diseases that affecting the general health of the body can be detected via oral cavity, which only dentists can relate. I am Anas Abdullahi Yamel by name, representing dental department. Before I go further, let me ask simple question. Do you know that dental health practitioners are supposed to be among the team that conduct ANC in each health clinic? So if you don't know, follow me, I will refresh your memory. My second question is that, do you know that oral health is integral to the general health? Do you know that the most hardest structure in human body is the teeth? That's why the chemist said only diamond can coat diamond. Likewise, that's why teeth can coat bone, although both are made up of calcium. What is oral cavity? Oral cavity refers to the mouth, which serves as a gateway of any substances into the body in normal circumstances. What is oral health? Oral health simply means overall health of the teeth, gums, supporting structure, and also the roof of the mouth, that is palate. Floor of the mouth, that is tongue, including the throat, lips, salivary gland, mandible, and maxilla. General oral health is a state of complete well-being of an individual, physically, emotionally, mentally, and even financially or economically. Not even merely the absence of disease or infirmity. You may not realize that oral health involves the nervous system, immune system, and the vascular system. According to the report, oral health means overall health of the tissue that allowed us to speak, smile, singing, kissing, taste, chewing, swallowing, kind of in pain, and convey a word of feeling and emotional through a facial expression. Not only is this aspect of the body related, but the health of the oral tissue is actually indicated to the health of your overall health simply by examining your oral cavity. So a dentist can examine your oral cavity to find a disease that affecting your general health by examining your oral cavity. In nutritional deficiency, microbial infection, immune disorders, and some forms of cancers. So I may like to tell my colleague students the sign or how a dentist can detect a person with a diabetes mellitus by examining his oral cavity. Do you know how dentists detect a person with diabetes via oral cavity? Do you know? No. Do you want to know? Yes. Follow me, I will tell you. A person with diabetes has a following sign reflects as a mirror in the oral cavity. Dry mouth in what we call xerostomia. Inflammation of the gum, what we call gingiva. Fading on the gum. Means discoloration or changing color of the gum. Ulceration around the mucosa means ulceration means a patches on a gum. Halitosis, mouth odor, and then a person with a diabetes, he used to breathe acid when he is breathing. So by this sign, a dentist can send a patient for a laboratory test to confirm for a fast blood sugar or random blood sugar to detect him diabetic. And then the next condition is hypovitaminosis. If we say hypovitaminosis, means the insufficient of the vitamin in the human system. So a person who have insufficient vitamin in the human system, he may reflect in his oral cavity. The sign that will reflect in his oral cavity is the gingiva will turn into pale pink, crack on the gingiva and the oral mucosal crack, and then there is white patches on the enamel, pale red on the tongue, and the angular cheilitis. So all these signs are the signs of hypovitaminosis. The next thing is acquired immune deficiency syndromes. what we call A. Do you know how we dentists are identifying an individual, or we are detecting an individual with HIV? Let me tell you. An individual with a dentist practitioner or a dental practitioner will find him with a parotid gland swelling, frequent oral candidiasis, gingivitis, erythema of the marginal gum, and dry mouth, necrotic ulcerative gingivitis. All these are signs that will present in a person who has HIV or who has AIDS. My dear brothers and sisters, the next step is osteoporosis, what we call root case here. This what is a condition that affecting the bone. I would like to ask, who will tell me what are the composition of the bone? The composition of the bone is similar with the composition of the tooth. That's why tooth is very strong than a bone. That's why tooth can cut a bone, but bone cannot cut a tooth. So the tooth was made by a calcium with 80% and the 20% is inorganic minerals. So osteoporosis leads to a tooth loss because the density of supporting tooth bone may decrease. A patient with osteoporosis has the following oral manifestation: high sensitivity, low bone density will cause tooth loss. The low bone density in the mouth can make it easier for a bacterial penetration and affect the gum, which leads to the gum diseases. A woman with osteoporosis tends to have a few teeth than a woman with a normal bone density. And also a woman with a low bone density or a woman with osteoporosis, it may affect its child when it has a osteoporosis. So and also let me prove you that a dental health personnel can participate in ANC, mean antenatal care, in the clinic or in the health clinic. Do you know that so many conditions that affecting the general health are affecting the babies in the uterine age? Syphilis, candidiasis, all are STI, sexual transmission infection, which affecting the fetus during development of the palate and the tooth. It will cause aminodental imperfecta, it causes orthogenesis imperfecta, it causes intrinsic stent and the other dental problems. But these mentioned reasons, my dear brothers and sisters, will make you that dental staff will be among the team that perform ANC in giving advice of nutrition, in giving advice of drugs that will stop the osteoporosis, meaning for the processing of the bone, and then that they will affect the development of the teeth and the development of the palate. And then there is so many systematic diseases that affect because of the oral diseases. My dear brothers and sisters, I said oral health is the mirror to the general health, because as drivers, if you are not clearing your mirror very well, it may cause an accident. If you are not brushing your teeth, it will make you to a life-threatening condition like heart diseases, stroke, diabetes, and other highly sensitive, critical, and dangerous diseases. I would like to stop here. Thank you for listening.